Our next speaker is Dr. Augusto Miravalle, who is the chief of the Division of Multiple Sclerosis and Neuroimmunology. He is an associate professor of neurology in the Department of Neurological Sciences at Rush University. He is board certified in neurology and subspecializes in MS and neuroimmunology. Dr. Miravalle received his medical degree from the University of La Plata, Argentina. He completed his residency in neurology at Loyola University here in Chicago, where he served as chief resident of education, and then subsequently went on to do a neuroimmunology fellowship at Harvard University in Boston, followed by a fellowship in medical education at the University of Rochester in New York. Dr. Miravalle is the recipient of the 2012 American Neurologic Association's Medical Education Fellowship Award, the 2015 American Academy of Neurology Research and Education Award, the 2015 American Board of Psychiatry and Neurology Faculty Education Innovation Award. He has been involved in both clinical and science-based research in the field of MS and neuroimmunology. He is a member of many professional societies and advisory boards. He is frequently invited to speak at national and international meetings. He's published numerous articles and serves as a consultant to various scientific organizations. We are extremely honored to have him here tonight. This is a huge privilege for us. He is going to speak on the topic of brain health in MS, new frontiers in patient care. So, Dr. Miravalle, we thank you so much for taking time out of your schedule to speak to us.
Very good. Thank you for that wonderful introduction. Thank you for inviting me, Mindy Eisenberg, to this wonderful event. It's great to see the energy in the room. For those of you who are joining us online, the room is packed full with people with great energy. So hopefully you can also sense some of that from your homes. So today I'm going to be brief, but hopefully impactful, because the topic of brain health is something that I hope everyone leaves today with some ideas on how to improve your brain health step by step. So we're going to talk about what are the current recommendations for brain health interventions in multiple sclerosis, discuss briefly the scientific evidence behind the importance of promoting lifestyle interventions in MS, and then I'm going to briefly discuss what we are doing at Rush by incorporating a comprehensive brain health program into the care of our MS patients. Let's start with the definition, and we are fortunate that the American Academy of Neurology took the initiative to actually come together and define brain health. And what I like about this definition is that it tells us that this is a continuous state. It's something that you never graduate from having brain health. It's something that every day you can do something to maintain or to attain the maximal function of the brain to support the most important functions, which is physical, mental, and social well-being. And the last portion of the definition is what I like the most, which is through every stage of life. So you're never too young and you're never too old to start doing something to promote your brain health. So this is a nice definition. And with that, we also know that what are the components that constitute those activities or functions in life that we can do to promote brain health. And you have them listed here. Some of those were already discussed before, which has to do with diet, nutrition, physical activity, but also blood pressure, vascular risk factors, control your weight, control all of those comorbidities, cholesterol that actually may negatively impact your brain health. Trauma, and that has to do with stress, whether it's chronic or acute stress, minimizing negative exposures. Of course, we all know about smoking and the risk that smoking brings to us. But we are learning a lot about alcohol. And I always say that now alcohol is the next smoking. The more we learn about the negative effects of alcohol in our brain health, the more we will realize that perhaps we've been overdoing in terms of alcohol in our diet, and perhaps we need to scale it back. Of course, social factors and structural determinants of health. A passion of mine is helping everyone, including marginalized populations, access health care. And we know that unfortunately there are systemic barriers that actually prevent individuals for certain groups, particularly targeting racial groups and minority groups, to access proper health care. So I think access to health care is equally important for everyone to be able to maximize brain health. And of course, sleep. Our brain cleans all of the inflammation, all of these processes that are occurring that is causing negative effects on the brain during sleep. So we have to have a proper continuous amount of sleep. So let's start with the recommendations that came more specific to MS patients. The first one has to do with early treatment with appropriate disease-modifying therapies. Dr. Bocci just mentioned that we have so many options, and I think those options have to be personalized and has to be discussed with our patients. This is briefly just to bring us all up to speed. You've seen this before. We know that multiple sclerosis causes relapses. Those relapses are represented here with these light blue bars. And we know that over time, the relapse rate reduction happens as a consequence of age. We also know that MS causes lesions, and those lesions may be asymptomatic or not causing symptoms early on in the disease. So these are the two outcomes that our medications are very effective at preventing. We're talking about a rate of efficacy close to 97% reduction in the likelihood of having new lesions or relapses. So this is a wonderful outcome that we achieved in collaboration with our wonderful sponsors in industry to help us develop these medications. However, we know that the second and perhaps most, I'm going to skip through these ones just in an interest of time. The second phase of multiple sclerosis has to do with progression. And that progression is clinically defined as that slow decline in neurological function that occurs at least for 6 months and is not explained by deconditioning or lack of physical activity. Let me give you an example. Progression will be someone that tells me, well, I'm doing well, but I've noticed that in the last year, my right foot is a little bit weak. And in the past, I was able to walk for 2 miles, and now I can only walk for maybe 50 feet to 100 feet. So that will be an example of progression, something that is sustained, something that is progressive, and something that is actually usually leads to a loss of function or disability. And unfortunately, we don't have therapies that are very effective at decreasing the likelihood of progression. To some degree, the therapies will impact progression, but it's a modest effect on progression. And just to make things a little bit more complicated, on top of progressing MS, also age plays a factor into making all of these outcomes perhaps a little bit more difficult, whether it's cognitive decline, difficulty with memory, attention, concentration, and fatigue. So how do we fix all of this? How do we make sure that our patients, not only we can prevent relapses, we can prevent lesions, but also we can maximize in the ability of the brain to minimize progression and improve function? Well, the good news, and it was mentioned before earlier in the talk, is that the brain is very plastic. The brain is one of those organs that actually can adapt and can change, particularly when facing difficulties. In this case, will be inflammation. And we have what is called a neurological reserve. And that's kind of like your savings account in the bank, right? So that will be the amount of brain that perhaps you're not using today, but you have as a way to back up or to perhaps get engaged into activities that you're going to do in the future. So that neurological reserve is something that we count on as we age, as our brain shrinks as a consequence of aging. We need to use that reserve to continue to do the things we want to do in life. But also we use reserve when we try to do something that is out of the ordinary. Let's say that tomorrow you get inspired and you want to start learning a new language. As you learn this new language, you're going to be using your reserve to try to create a new area in the brain that is now specific to that new language. And that process of developing a new skill in your brain is happening constantly. And it's very plastic, and the brain is going to adapt, the brain is going to change based on the things you choose to do in life. So we can take advantage of that wonderful function of the brain to also improve functions that perhaps we lost as a consequence of multiple sclerosis. So to dive a little bit deeper into brain reserve, we know that there are two types of brain reserve. One that is directly linked to the size of the brain. Some neuropsychologists call that the passive or the brain reserve. And that's something that we can't do much about it. We are born with certain number of neurons, and we are born with amount of brain that actually over life we may lose as a consequence of aging. Also, we know that in multiple sclerosis, the rate of atrophy may be a little bit more pronounced. Now we have tools, and it was mentioned before on MRIs, that we can quantify the size of the brain. We can measure brain volume, and we can actually see if our patients have the expected amount of brain volume and how fast or slow that brain volume loss is happening over time. One of the things that perhaps is important to know is that something we can do in multiple sclerosis for brain volume loss is to be on medications to prevent that brain atrophy. And so we know that these highly effective therapies have a significant reduction in the rate of atrophy that is comparable to the atrophy that we see in healthy aging in individuals without multiple sclerosis. But perhaps the area of the brain reserve that is most interesting to understand is what we call the cognitive or active brain reserve. And that will be not just related to the size of the brain, but that's related to how we use the brain. So for a moment, I want you to imagine that the brain is like a computer. So the passive brain reserve will be your hardware, will be the amount of memory that your computer have. And unless you change the computer, there is little you can do. But the active brain reserve will be your software, how many programs you can input into that computer, how rich you can make that computer function depending on what you want to do. So there is a lot we can do with that cognitive or active brain reserve, and lifestyle interventions will have a direct impact on how we actually utilize or maximize that brain reserve. So this is perhaps the area that we can, despite having atrophy, despite having perhaps a brain volume loss that is profound due to multiple sclerosis, we can still do a lot to maximize that brain reserve that we have control on. So what is the evidence that what I'm just telling you is true? So there's a lot of research that actually looked into brain reserve, but perhaps the most impactful is this one. This is a functional MRI. So this is an MRI that perhaps you are not familiar with. The MRIs that you have look at the structure of the brain, but this looks at the function of the brain. And what it does is, as we do certain things, parts of the brain will get activated. And in this study, they had a group of healthy controls, and they asked the healthy controls to tap a finger inside the functional MRI machine. And everything that you can see in orange, red, and yellow, those are the areas of the brain that got activated after tapping a finger. So you can see that this individual activated those red areas by just simply tapping a finger. So what they did is they brought an MS patient of the same age, and they asked the patient to tap a finger. And I'm going to ask Carly, can you tell me, when you compare the healthy control at the top to the MS patient, which one has more red and yellow? The MS patient, exactly. And what is that telling us? What that tells us is that the MS patient, in order to do the same function, had to activate more brain. So let me ask somebody else, this nice gentleman that is here. If you think that a person, in order to do the things they want to do, have to constantly activate more brain, how do you think that brain is going to feel at the end of the day? Fatigued. So this is one of the ways in which we can understand fatigue in multiple sclerosis. You're constantly having to activate more parts of the brain in order to do the things you want to do. And the reason for that is because those pathways that actually have been affected by inflammation are not working the way we want. So one of the ways to actually see that invisible symptom that every patient with MS has, and it's so frustrating when the patients try to tell you, but I'm tired. You cannot see that, but I'm actually exhausted. So we see it. We can see that. And this is one of the ways in which we can measure that. But I always like to give you good news. So the good news is this. Can we fix this problem? Can we alter the way in which the brain is overly compensating for the things we always want to do? And the answer is always yes. So a follow-up study looked at patients with multiple sclerosis, and they did a baseline functional MRI, and they measured the amount of brain that was activated to perform a motor activity. And you can see here a lot of red, a lot of orange, and a lot of yellow, right? So that was baseline. That was before any type of intervention. So they asked these patients to now enroll into a 3-month program of physical therapy and exercise. And that was not that difficult to do. It was 3 days a week, half hour a day. And after those 3 months of physical activity, they brought the same patients into the same MRI, and they asked them to do the same activity. And what do you see? There is a profound reduction in the amount of brain that was needed in order to accomplish the same task. And what do you think happened to that person's levels of fatigue? Significantly decreased. So this is one of the ways in which we can actually alter the way the brain is compensating by actually doing the things we want to do. And consistently, this happens over and over and over every time we try to understand, for example, the benefit of exercise in multiple sclerosis. We know that fatigue, yes, is a problem. And when a patient in front of me tells me I'm tired and I tell them you need to exercise, they look at me thinking, what part of I'm tired you didn't hear? And of course I hear you, but I know that over time, if you exercise, that level of fatigue is going to decrease. We now have guidelines of exercise, how many minutes a week, what type of exercise you should be doing. Those guidelines are going to be revised now because one of the mistakes of the group that developed the guidelines is called them the Canadian guidelines for exercise in MS. And people think that only works for Canadians, but they don't. It works for everyone. And then what happened is that it was a research study that was supported by a grant from the Canadian National MS Society. So the Canadian name went there. But actually that works for everyone. And that guidance tells us is 2.5 hours a week for 6 months. That's the minimum amount of exercise that we need to do in order to get the benefits that we want. Ideally, half of that should be aerobic and the other half should be strength training. As we get older, we should increase the strength training exercise to give more core balance, to give more stability, and also more muscle mass that we usually tend to lose as we get older. So this is just an example of how sophisticated the field of exercise in MS is becoming. There's a lot of science behind that. The one article that I want to point out to you is this. Early on, I told you that the size of the brain, there is little we can do to improve. That's not totally true. There are parts of the central nervous system of the brain that actually we can promote new neurons, something we call neurogenesis. So the creation of new neurons in the brain is possible only in small parts of the brain. One of that is called the hippocampus, and that's our memory center. And there are 2 activities that actually can promote neurogenesis in the hippocampus. One is exercise, and the other one is very related to today's meeting, which is mindfulness. So practicing mindfulness is one of those areas that through stress reduction can promote neurogenesis in the hippocampus. So you're in the right track. You're in the right place today. You're learning something new, and hopefully you're going to incorporate some of this into your life. And just to finish, I'm going to skip into the one area. We don't need to talk about diet. We had a wonderful presentation by Dr. Holland. Just one area, which is how do we implement a comprehensive patient-centered brain health program? And it was mentioned before, we should do better than simply telling people you need to exercise 2.5 hours a week. That's easy for us to say, very difficult for you to do. So what we've done at Rush is we took the initiative to actually have a system and a program that will allow patients not only to learn, but also to change behaviors based on these evidence-based practices. And the Brain Health Program at Rush is being developed to provide these 3 tiers of intervention. So tier 1 is for everyone. You don't have to have MS to benefit from these activities. The tier 1 is community. Tier 1 is entire population of individuals that want to learn more about brain health. Tier 2 will be for MS patients that are stable. So let's say that your MRIs are stable, but you want to learn more about what can I do to proactively prevent disability progression over time. And tier 3 will be for that MS patient that is not doing well, someone that actually we need to do something to act. So in each of these tiers, we have initiatives. We do an annual brain health fair. This is in Colorado. We are hoping to bring that here to Chicago as well. This is for community involvement. We have monthly webinars that happens the second Monday of each month at 6 p.m. Those are free. Those are community-based education. And we call that Conversations on Brain Health. And every month we talk about a different topic related to brain health. You can register for free with that QR code. Tier 2 will be for patients that are stable, that they want to do a little bit more. And for that, we have what we call the Brain Health Masterclass for Multiple Sclerosis. This is a free program. It's a 3-week duration in which in those 3 weeks, patients access over 21 short videos talking about different topics related to multiple sclerosis and brain health. And then they have access to 6 live sessions on Zoom with experts. Dr. Holland is one of those speakers to talk about diet, exercise, nutrition, and other things. And then the tier 3 will be for, and this is just to show you some of the benefits, patients that actually completed this program had a significant improvement in the understanding of brain health, in understanding multidisciplinary care. This is perhaps one of my favorite. 80% of patients became more familiar in distinguishing the difference between MS progression and deconditioning, which is a very critical difference to understand. If you feel that you're getting worse, is that because your MS is progressing or because you need more exercise? So being able to distinguish that is actually critical. Patients like it. We get a 5-star review consistently, and I'm going to continue to brag about it because that's exactly one of the outcomes we want. We want our patients not only to learn, but actually to feel that there are resources out there. There is a community of individuals that are working to make sure that you actually live the best life that you can possibly can. And the third one, I'm going to leave to Adrienne Castillo because she's the lead of this program, which is individuals with multiple sclerosis that perhaps are not doing well. What can we do to have a one-on-one personalized approach to helping individuals implement lifestyle interventions the best way they can? And for that, we developed what is called a brain health clinic. Adrienne is the next speaker. She's going to talk to you a little bit more about the details, but that's a one-of-a-kind resource. Patients have a one-on-one consultation with a nurse practitioner that is certified in the American College of Lifestyle Medicine to talk about all of the different aspects that perhaps we need to work on. So with that, we are hoping that over time, by providing the information, the education, the resources, and the space in the clinic, we can actually help patients have a better life and understand how to start taking the first steps into maximizing their brain health. So in the interest of time, I'm going to stop right here. I'm going to just move to a few of the biomarkers we're using in the research component of the program. It was mentioned before, icometrics. This is a wonderful tool. It's ultimately utilizing AI to quantify outcomes on the traditional conventional MRI. So you can see this individual, everything they see in blue is the cortex, the brain, the gray matter. We can actually quantify brain volumes, we can quantify lesions and follow that over time in every patient. And over time, we are hoping that with all of these interventions, we can actually help patients walk through the very difficult, challenging path of changing lifestyle. But hopefully today you learned that it's critical, it's very important to truly start changing our diet, the way we live our life, exercise, and other issues that are related to brain health. So I believe I have the last slide to brag about our 7-day access. I mentioned before that access is important. None of these will be beneficial if people can't access these wonderful resources. So at Rush, we took the commitment to have a 7-day access program. What that means is that patients that request a new appointment to see anyone in the MS Center has to be offered an appointment within 7 days of request. Early on, I thought that was going to be an impossible task. And when I joined Rush, I think I became the least favorite division chief in the system because I thought this is going to be our priority. And not only that, every incentive for every member of the MS Center was contingent upon us meeting this metric. So as you can imagine, I was probably the least popular person walking on the hallways. And just to make it even more dramatic, the benchmark that we set to ourselves was 80% compliance. So that means 80% of patients that request an appointment has to be offered within 7 days of request. And you can see the numbers. We finished at 87% compliance for 2 years in a row. So what that means is 87% of patients that called requesting a new appointment with anyone in the clinic was offered an appointment within 7 days. So this is our commitment to make sure that we actually provide this access to anyone and everyone in the community. So with that, what we're hoping to do is this: stop relapses, stop lesions, stop progression, and maximize neurological reserve. So as you can imagine, it takes a village. So many of us are behind all of these wonderful resources. We have 5 fellowship-trained neuroimmunologists. Of course, we have Adrienne Castillo. She's our nurse practitioner, and she's the director for the Brain Health Clinic. Kathy Kiefer is the education manager. She oversees all of the educational resources that we offer to our patients. Jules is the research coordinator. She's collecting research outcomes in every visit. And then we have this wonderful list of collaborators. You already met Tom Holland. He's our expert in microbiome. Monica Diorio is neuropsychologist, and she has developed a neuroresilience clinic, which is a 6-week cognitive stimulation clinic. And Zerfas is a physical therapist that specializes in neuroplasticity and prehabilitation, which is how can we use exercise to prevent not only deterioration, but to improve function. Laura Morris is the daughter of Martha Claire Morris, the person that developed the Mind Diet. And Laura is a professional chef, and she does classes and cooking lessons for patients on how to practically make meals following the Mind Diet. If you join the conversations on brain health, the session in November is going to be Laura Morris explaining how to prepare the holiday meals for Thanksgiving and Christmas following the Mind Diet. So don't miss that chance to meet her. Rob Model is a world-known researcher in exercise in multiple sclerosis, as well as Jennifer Bertrelli, Sheila Dugan, and Clara Takesh. She's our music therapist. So it takes a village, but as you can imagine, we are very proud of that, and we invite you to check our resources. With that, thank you very much, and I'll be happy to answer any questions.
Thank you, Dr. Miravalle. So I'm going to start with a question from online. Here's our question. Doesn't it also mean that if MS patients are working harder, they are getting more brain volume?
No, the volume itself doesn't change when you work harder, but the density of the connections between brain cells does. So the brain cells talk to each other. And the density of the connections between brain cells gets thicker as we use those brain pathways. So yes, there is a volume change, but itself the size of the brain doesn't change with activity.
Comparing primary progressive, secondary progressive, and relapsing remitting MS, is there any differences in how the brain is affected by those types and how they respond to exercise in this?
Great question. The short answer to that question is no, no difference. We are, as a field, we are trying to move away from the distinctions of those clinical phenotypes, even though now insurance companies are forcing us to use those codes. But we're trying not to, because we understand that MS is one disease. And most importantly, the benefits of all these interventions are the same regardless of the clinical type of multiple sclerosis.
Any other questions? Right here.
Hi, Dr. Miravalle. If we know that the drugs are supposed to prevent us from getting lesions, and the goal is to not have new symptoms and new lesions, how do we track progression even if there is no lesions or new symptoms? That's number one. And then the second question is, we know that we're on these drugs to not get new lesions. But what if we get new symptoms? Are neurologists concerned just about the new symptoms too, or just the lesions? And I'm trying to take that all in.
Yeah, that's an excellent question. So in general, we measure stability by looking at lesions, relapses, and clinical progression. So that's the basic framework. But sometimes we use certain tests like biomarkers to truly understand other kind of inflammatory markers that are behind the scenes. But in general, symptoms without any progression do not constitute failure to a therapy, right? So in that case, what we do is try to implement symptom management therapies. So the question is, if neurologists are not concerned about new symptoms, if there are no new lesions, well, to some degree it's true. But we still have to address the symptoms. But it's reassuring that there is no evidence of new inflammatory activity.
I have one other question from online. Are RUSH programs accessible to people living in other states?
So some of the program, yes. So what I mentioned before, the tier 1 component, yes, which is conversations on brain health. That's open to anyone and everyone, as well as the tier 2 program, which is the masterclass. So the 3-week program for MS patients, we opened up to anyone in the community, including patients from other states. To date, we have offered that masterclass to over 500 patients, and I think we hit every single state in the United States, including we had a patient from Canada and a patient from Mexico.
What is the relationship between MS and Alzheimer's? How do they end up, yeah.
That's an excellent question and kind of complicated answer, because for decades we thought that MS, in a sense, has an inverse risk of developing Alzheimer's, right? So there is kind of like a lower risk of developing Alzheimer's if someone has multiple sclerosis. Now we are learning that that might not be totally true. And I think part of that is because we are becoming better at diagnosing Alzheimer's disease, both clinically and by certain blood tests. So the recommendation is this. The good news is that all of these brain health activities that help with MS also help to prevent Alzheimer's disease. So while we continue to figure that out, I think that the best you can do is live a healthy life. So that will help you prevent both. But also any concerns, any clinical concerns of memory loss, probably talk to your neurologist, and we can do a screening for Alzheimer's disease as well.
All right, we have one other question right here.
Doctor, thank you so much for all your knowledge and all the participants that have shared such valuable information. Truly appreciate it. My question is in regards to the AI-assisted imaging. For a patient to have that, like a further evaluation, can they bring in an MRI that they've had previously done, or does it have to be taken there at Rush?
Yeah, that's a good question. No, unfortunately, it has to be done at Rush because we had to change the entire protocol in order to be compatible with this program. So unfortunately, if you do the MRIs elsewhere, it's not going to be compatible with this program.
Okay, another question from online. Thoughts on the Octave MS disease activity test?
Yeah, so the Octave is a multi-biomarker panel that is available for patients who wants to get access to certain blood tests and understand kind of like inflammation. There are many different options that we have these days to check for biomarkers. I prefer to minimize the number of tests that I order and truly understand. And related to the microbiome question too, so there are different tests that we can order to check your microbiome. Mayo Clinic has one. There are many commercial ones. I usually would advise patients is like, well, before you engage into a test and you pay for it, we need to know what are we going to do with the result. And for the microbiome, usually what I say, well, if the result is that, yes, perhaps your microbiome is unhealthy, guess what are we going to tell you? You need to eat better. So, one of the challenges of the test is that the outcome usually is going to result in the same advice, which is let's look at your diet, let's improve your probiotics, your prebiotics, try to eat healthy. So I will say at this point, I don't see a lot of clinical utility of checking the microbiome test. I think it's around $400, so it is an expensive test. But of course, it's available if someone wants to check it. The same with the Octave. The question is, what are we going to do with the results?
Could you tell us more about brain fog?
Yeah, so brain fog is common in multiple sclerosis. Also, brain fog is common as a side effect of multiple medications that we often use to treat MS, right? So the medications for pain and spasticity can cause brain fog. So the way we approach the assessment is look at all those factors, understand, what is causing brain fog, is there any concerns on cognitive decline, and truly diagnose the problem. Is this a side effect of a medication, or this is due to multiple sclerosis? And if we conclude that it's due to multiple sclerosis, the right next step will be a referral to neuropsychology to do more testing, more assessment, and come up with a way in which we can hopefully help patients improve brain fog. So the question is, what will neuropsychologists do? So cognitive behavioral therapy is an intervention that is actually very effective in helping at least address some of the cognitive decline that can happen in MS. So there are different providers doing cognitive behavioral therapy. The program that I mentioned before, we have a 6-week program. And in those 6 weeks, a neuropsychologist will work with patients on techniques to improve processing speed, memory, attention, all of these domains that perhaps are impaired.
Okay, I have one last question from online. Can people come to Rush for periods of time to join programs?
Yeah, so we are open to, as I said before, to anyone and everyone. We have patients coming from other states. So this is something that we would like to offer to as many patients as possible. And also, I would love to see this type of approaches replicating in other centers. So we are working with colleagues in other MS centers to try to bring these programs locally to other regions. So this is something that we are proud that started here, but we would like to see disseminated in other places as well. Well, thank you very much for your questions.